Hi, guys. Welcome back to the Pre-Med Pod. Today, we were so lucky to have a chat with Dr. Brittany Ladson.
We learned a lot from her. It was really useful and beneficial information, not just for us, but for anybody who's interested in going into the medical field. And it was a great opportunity.
Hi, everybody. Welcome to the Pre-Med Pod. Today, we are with a very special guest named Brittany. Brittany, do you want to tell us a little bit about yourself and what you do, your profession, and how you kind of got onto social media?
Absolutely. My name is Brittany Ladson, and I'm a current second-year emergency medicine resident in Michigan. I graduated from Michigan State for my bachelor's degree, and then I also graduated from Michigan State College of Osteopathic Medicine for my medical degree. So I'm a longtime Michigander, and we'll see in the future if I end up, staying here for permanent work. Um, in the beginning, I definitely didn't know that I wanted to do medicine or even healthcare in general. My entire family does like finance, accounting, business. And so I thought like it was almost in my DNA to continue that, just because like literally everyone in my family does something in that field. So I did an internship, a summer internship during high school, and realized that that's just not the work that I like to do. I don't like to dress professionally. I don't like to work in a cubicle. I don't like just making phone calls and being on the computer all day long without getting up. I thought it was very monotonous and definitely was not at all what I wanted to do with my life. But then, of course, comes the question then, what do I do with my life? And I was thinking about doing some volunteer work. So I started volunteering at the nursing home, working with their, just ice cream socials, bingos, the fun stuff. And then I got more involved with like the physical therapist because they're there all the time working with almost everyone. And I realized I liked the healthcare field in general. Didn't know exactly what I wanted to do in the field. So I started doing some shadowing of the PTs, and then I eventually moved on to like volunteering in the hospital and shadowing some physicians. And that's where I knew like this is definitely the environment that I want to be in. I really enjoy the people, the company, the camaraderie, the collaboration. And so I knew that's what I wanted to do. So when I started college, I was in what was called Lyman Briggs, which is like a science residency hall, and was in the honors college and pursued that pre-med route. And here I am today, approximately one third done with my emergency medicine residency.
That's super cool. I really um resonate with that because similar to me, I at first I didn't always want to be a doctor, but I actually just had the opportunity to shadow a trauma surgeon,
Mm,
and I have an internship with a radiologist. So I've kind of found my way, and I'm very, very happy with medicine, and I definitely want to pursue it in the future. So you said that that was what you did in high school, the summer thing. What were you like in high school? Like, what were your classes like? Did you take APs? Did you take dual enrollment? What was your background in high school?
So for high school, I did not go to a typical high school. I went to an international baccalaureate program. So it's for people that don't know, it's a program where it's housed outside of your normal high school, and you're with students from it. For me personally, it was from the entire school district um, that were there. My class sizes were really, really small. The graduating class was only 100 students, whereas at our normal high school, it'd be like 600 plus. So the size was much smaller, and we did pretty much like all AP classes. There were like some actual AP classes, but most of them were IB classes, which when it comes to enrolling in college, those transferred the same, and you get the same amount of college credit because they're the same level. And definitely being in an IB school is a lot of work. I knew that going into it, but like reflecting back now, like what my high school experience is like and what like today's high school experience is like, it was so much harder, so much different. I feel like kids these days have it so much easier, to be honest. Um, Being in an IB school, we had to do several hundred hours of community service in order to graduate. we had to write what we called an extended essay, and that was a 4,000 page, or I'm sorry, 4,000 word essay about a specific topic. So I studied um, the Salem witch trials, which is, I think, one of the coolest things ever. Um, and you had to do that in order to graduate. There's also a bunch of different electives that weren't elective. You had to take them. Um, and one was called like theory of knowledge. So you're actually like thinking about the way you think. So it's very intellectual, very cerebral. um and so it was truly a lot, like having 8 classes at a time, where the high schools typically have about 6 classes at a time. It was a lot of work, but it definitely prepared me very well for college. When it came to making that transition, my things were all social issues. Mine weren't related to the school work for the most part, because I've been used to having to do a lot of work, really, buckling down and spending my whole night doing stuff. So blessing for sure, but a lot of work, especially when I look back on it.
I always hear about IB courses when I'm going to different college tours, and I've never actually heard of a school that use those courses. I always heard of the APs. I think they're pretty popular now. And so with the IB courses, how are they kind of different from like an AP class?
So they're actually very similar. The content is for the most part the same. Um, and that's why, for instance, if you take an IB class, you can go and take the AP exam for it because you've already prepared for it completely. But the IB course just has their own set of learning objectives that they base their exam off of. And I think the exam is honestly a little bit harder because there's more written components on it. And it's a multi day exam. So at the end of your high school career, that last month, like that entire month of May, you're doing like 24, I think it was like 24 plus exams. So like let's say the IB biology course, you'll have a biology multiple choice day, you'll have a biology written day, and sometimes there's more than one written day. And the same thing goes for like all classes. So like your history class, you'll have a history multiple choice day, history written day. Same thing with Spanish. Same thing with everything. So it's a lot of work, but you prepare to take the AP exam. And so a lot of students during that month will sit for the AP exam as well, just because if you, um, let's say you didn't perform well on your IB exam, it was just, a bad day, maybe you had an illness or who knows, then you can go take the AP exam, get college credit for it if you didn't earn that credit on your IB exam. So there's really no difference in content. It's more just the amount of testing that you have to do at the end, and that's about it.
So, using, I guess, what you learned in high school from the IB program, and if you took the AP tests, how did you go into undergrad knowing? I guess, I mean, I know that you knew that you wanted to pursue medicine in some form. So how did you take the classes that you learned in high school and applied them to, I guess, your chosen field of learning in undergrad? Like, did you realize you really liked biology, so you wanted to pursue biology? Like, how did that go?
Yeah, so what I noticed the most during high school is like there were some classes that I like didn't mind studying for, and there were some classes that I loathed studying for. Did not like studying for math at all in the slightest. But I definitely enjoyed preparing for my biology exams. I still to this day love like introductory biology stuff, like all the mitochondria and the Krebs cycle and all that stuff. I think it's super cool, and that's why to this day I still tutor that course. Um, so for me, that knowing that made me think like if I don't mind studying for this and I enjoy the content, then I can really excel with that in the future. I can manage doing a whole college degree in that area. Whereas if you asked me to do a math degree, which my freshman roommate did, I would say, no, thank you. That is the last thing I would ever want. And then also, I think another thing that I learned about those classes in high school was just like the way that you study for certain classes. For instance, math, you don't make flashcards more or less. Whereas biology, you can absolutely make flashcards. You can do vocabulary words, you can do all types of things for that. And just knowing that those study techniques helped me in those classes, helped me make that transition into college, knowing that that's the way I retain this specific type of information, and I can take that into college and continue that so my studying is as effective as possible.
That's really cool. I really like that, you're able to kind of determine your learning style and like what works best for you and kind of implement it into your life and your studies. I think that's a really good piece of advice because I think a lot of the times I know at least for me, I'm taking AP Gov this year and I'm personally just not a reader. I don't learn very well through reading. And so trying to find different ways that maybe do work better for me. So like you, flashcards and retaining information in that form is a lot easier for me than pages of writing. And so I really like that. I think that's a really great takeaway. And going off of undergrad, of course, you went to osteopathic medicine, you've done emergency. How did you like realize that osteopathic medicine was the route you wanted to take in the medical field?
So for me, Michigan State is a very unique school. They're the only school that has both an MD and a DO school on its campus. Most schools are either or. They have an MD school or they have just a DO school. So I felt like I had more options being able to be on campus for 4 years, preparing in the pre med um, as a pre med student, and being able to do different events and volunteer and stuff with both schools to see which one I liked better. For me, I just felt more comfortable at the DO school. I felt everyone was more nice. I felt very connected to the school. I felt like for sure, like this is where I want to go to school. So there was that element of just I enjoyed the school, so then I became a DO. But also, I believe um, that having the osteopathic hands-on manipulative medicine skills is relatively important. So I love to study abroad. I've done 5 study abroads at this time, and I might be doing a sixth soon. And in other countries in different areas, they don't have access to even things like Tylenol and ibuprofen. So if someone has a backache or a joint ache or something like that, getting just those basic things can be very challenging. Even like getting ice. Well, if it's super hot where they're living and they don't have electricity, how are you supposed to produce ice? So how are you supposed to treat this issue? Whereas your hands, they come attached to you, and so you have the knowledge. You use your hands, you can help them out, and you can see results in front of you, and you're helping a patient. It feels very satisfying to have that in that moment relief of their pain. So I think that is like super beneficial. In the long term future, I don't see myself working internationally for a long period of time, although at one point I did, and that was a huge part of why I went to DO school. But still, at this point, I think some intermittent international travels for medicine reasons would be something I still want to do. And then also just like the holistic approach to being an osteopath is very important. I know that I would want to be viewed holistically if something were wrong with me, especially something that was maybe obscure or people weren't sure of. That would be the way I'd want to be treated myself. And so I always have that approach um, to when I see patients in the emergency department. If someone comes in with knee pain, is it because their hip is bad? Is it because their ankle's bad? Is it because they're experiencing homelessness and they're on the ground all day and all their joints really hurt? Like there's so many reasons, social reasons, physical reasons, even mental health reasons that can impact your physical health. And so that's why I think having that philosophy as a core principle of being an osteopath is super important.
We actually had an opportunity to interview a osteopathic medical student last week. We were definitely interested after that. After we heard about it, we were like, "Ooh, this is really cool." We never like really knew that it was like this. So, it sounds like really really beneficial to have. I'm definitely going to like look into it in the future because I never like realized it was like similar, and then you have the additional like tools on top of it of the osteopathic medicine, which I think is really beneficial. So I'm definitely going to look into it. Thank you for that insight.
Mhm.
But I actually have a question. So, how did you know? I mean, through osteopathic medical school, I'm assuming you'd have the same like opportunities to shadow doctors and stuff. How did you figure out that emergency medicine was the track for you?
So for myself, I originally went into medical school thinking that I wanted to pursue being an OB-GYN, obstetrics and gynecology. That was based off of some study abroad that I had done before, and I enjoyed the labor unit a lot. And once I got into medical school and we started taking like our OB-GYN course, and actually my first rotation of medical school was my OB-GYN rotation, I realized I do not like gynecology at all. I don't like gyn surgery. I don't like gyn clinic. I just love labor, but I don't like anything else. So I just in my mind thought like how can I pursue a residency program where I hate half of it, especially with it being a 4-year program. That's a longer program. So I just thought like that doesn't sound like a recipe for being like mentally healthy and enjoy my residency, even if I love part of it. So I thought I definitely need to make a change. And so I thought to myself, what are the things about the labor unit that I enjoy and what can I take from that and apply to a different program, a different specialty? And so I thought like, well, like being hands-on, I like kind of not knowing what to expect. Like you don't really have a schedule kind of. And I like the collaboration. Especially during laboring, you have a team of nurses, you have your if you need the neonatology crew, and then it's just like really collaborative. And so I thought like, okay, my emergency medicine rotation's coming up. I was super lucky. Mine was super early on in my clerkship. Normally, it's unfortunate. At a lot of schools, they have emergency medicine as a 4th year elective, so they don't even have to take it. Whereas in my school, it's a 3rd-year core rotation. And so mine was the third block of the year. So I felt very lucky to have it super early on. I can't imagine having it like the last block of the year because then auditions start that following month. And so when I was in the emergency department, I just loved every moment of it. I loved the collaboration during like high acuity events. I loved the diversity of the patient pathology, the patient's chief complaints. It was just really like motivating. I felt like very motivated when I went in there. And so was pretty certain that I wanted to do that at that point. I did a couple of conferences. There's like Michigan emergency medicine conferences that I went to and to just get some more information, meet more people, and that's where it really became solidified that that was what I wanted to do and I was going to do anything in my power to make that happen.
That's so cool. I really like the ideas behind, again, you're very aware, I feel like, of what you knew you liked, and like again with like your studying habits, knowing the key parts of what you liked and didn't like about OB-GYN and then being able to implement it into other parts of medicine, I think is really really a gift. And again, I think everyone can take away from that. Going back a little bit, when did you begin your study abroad programs? Because you've done 5, correct?
Yes.
Really cool. Where did you go and kind of how did you receive those opportunities and go with them?
So I started doing study abroads during my second year of being an undergraduate. I started off with doing what was called the MedLife study abroad. MedLife study stands for Medical Education and Development for Low Income Families Everywhere. I'm still surprised that to this day I can remember that acronym. And that was to Esmeraldas in Ecuador, and that was my first time out of the country. I've never, but well, besides Canada, which for a Michigander does not count, and because my family never traveled internationally, like still to this day, my siblings don't even have passports, um, and so that was extremely eye opening. I have never seen things like that before. I didn't know the level of poverty in that specific area was as bad as it is, and that was extremely eye-opening, and I am extremely grateful for having that opportunity, especially early on, to know how certain people in the world live and how they function with what they have and what they don't have. They're extremely resilient people and extremely strong-willed and strong people. So that was my first one, and I enjoyed it. It was a week long, and I did pay for that one like out of pocket because that was like my first experience. I didn't know like what to do. And so the following year, I went to Merida, Mexico. That was a study abroad program through the DO school at Michigan State. And I was super lucky. I applied for a few scholarships and I got them. And so that study abroad was paid for. That study abroad was more hybrid of some lectures that we had from the locals. and then also a lot of shadowing in their hospital system. So that was a really cool hybrid of things. We saw things like neurosurgery, and we also saw laboring. We saw like a whole diverse we had a very diverse week of what we saw, and it was really cool to have the lectures from the local physicians to really um, get us to understand why they do what they do, how they do it, and how they manage certain things. After that, um, I went to Peru with the medical school. So that was my second year of medical school, and that was a 2-week program where we now that we are medical students, we have some experience. We actually were able to work on patients, and so we would see patients with translators and be able to diagnose them with whatever. And we had a list of medications that we could prescribe, so like ibuprofen, Tylenol, allergy medicine. And then also if someone was dealing with like constipation, we were able to actually go and see like, okay, here are the fruits and vegetables that you have in your area that you have access to. Here are the ones that are high fiber that would help you with chronic constipation. So it was very geared towards being sustainable and having them have great long term outcomes. So that was a wonderful program. And then I went to the Dominican Republic also as a medical student. I was with a lot of pre-meds, so that was a really cool opportunity. I was actually the only medical student that went on that one. So I felt like I was in a very like leadership role trying to um, share with the pre-meds everything that I've been through and all of that. That was another fun experience similar to going to Mexico. And I also got a lot of scholarships for that. So that was wonderful. And then finally, it would have been a year and a half ago, I went to Malawi in Africa. And that was as a fourth year medical student. That was like one of my final rotations of medical school. And that was a 6-week program, so a very long program. And I got a little bit of scholarship money for that. And I was in OB-GYN. So I just wanted a little bit more OB-GYN experience before I had to give it up for life, before starting emergency medicine residency. And it was super cool. It's interesting. Their medical students only do cesarean sections. They do not participate in vaginal deliveries. And so I was there with the midwives, and they just let us do whatever we wanted to, because they're like, oh, you guys are medical students. Like, here, medical students do more advanced stuff. So you're well qualified to help with the laboring. And so I got to catch babies, and they have a very specific way that they swaddle their babies after birth. And so I got to learn that. It was one of the coolest experiences, but definitely like very eye opening, very hard, like having to walk to work every day. Like we didn't have a bus or a car or anything. So we had to like walk to work every day. We had to manage how to find our lunches. Like it was very eye opening. So that was wonderful. That was my fifth one. And then I'm also considering doing a sixth one next year during my third year of residency for a month, going to possibly Colombia to do an emergency medicine rotation there. So, but we'll see if that happens.
That is really, really cool. You know, as we've been going on the college tours and stuff, everyone's like, "Oh, we have study abroad programs. We have this, we have this." And I've never thought of it like being possible because, like as a pre-med, I want to be a pre-med and I want to do neuroscience because I want to be a neurosurgeon. Um I've never thought like, oh, like yeah, I'll be able to do that, but hearing that you were able to and that they were so worthwhile, I definitely like it makes me think like I definitely want to study abroad. Like going to a place that has it as an option would be super super cool.
I
Um
would absolutely suggest studying abroad. For me personally, I did not have a passport before the first one. I had to go about getting one. Like I said earlier, my whole family doesn't have passports. So I'm coming from the most untraveled family maybe ever. And to know that I could still do that. And I think there is like, you catch the travel bug. So once you go to one place, you just want to keep going and keep going. Um, and so it's definitely worth it. If there's a concern about cost of programs, yes, there are scholarships to apply for, but even if you don't have the time to apply for them, or you don't get accepted for the scholarship, you're going into so much debt going into medical school. Are you going to notice an extra $1,000 or $2,000 on that tab? Probably not. And the experience that you're going to get from it is worth so much, both for yourself personally and for your resume, that I would absolutely suggest just doing it, making sure that it happens at least once during your education.
no, yeah. I'm definitely gonna look into that because, I mean, it sounds super, super worthwhile.
Did you have a specific connection with the areas in South and Central America? Of course, you went to Malawi as well, but was it just the opportunities that came up, or was there something specific about travel and being able to volunteer in those areas that kind of guided you towards that area of the world?
I am an avid Duolingo person. So I think I was doing my Duolingo right before we got onto this call, and I'm at like a 1,300-day streak right now. So I'm trying to learn as much Spanish as I can. So going to Spanish speaking areas is my priority. But when the Malawi trip came on as an opportunity, initially I was waitlisted from the program and I was super upset. But when I finally got it, I'm like, there's no way I can pass this up. Like, when am I going to go to Africa again? I wouldn't feel safe going by myself. My fiance does not want to go. He told me very specifically, you'll never find him in Africa. So I'm like, I have to do this um, because there's just no other time in my life that I would do this. And they speak Chichewa there, and I attempted to learn some, but to be honest, it's very difficult for me, and I didn't learn all that much. I know like Zikomo, which means thank you, it means hello, kind of means everything, but that's as far as I got. So for me, it was more the language that attracted me to Central and South America, learning the different dialects, learning the different like slang words. Like so, instead of por favor, it's porfa. In Mexico is like a little shorthand thing. So I just loved that, and that's why I'm excited to possibly go to Colombia to learn just some more Spanish, some more dialect, and just keep stockpiling it all.
I love that. That's so cool. I just I took AP Spanish last year, and when you take the AP test, if you pass, you're able to get your seal by literacy. And so thankfully I passed. And so I'm
Nice.
really looking forward to getting that. And yeah, South and Central America, I've never traveled to, but I think there's really no better way to learn a language and a culture than actually going. And so I'm personally like South Central America, Spanish speaking countries in general are high on my bucket list because I do think like you learn so much about a place by just going. See, and I took Spanish and I never knew porfa was a shorthand for like por favor, like, and just little things like that that you pick up I think are really beneficial and unique to get to learn about different places.
I have a question because you brought up a few times, like for your mental health. You said like you knew that you didn't want to like do the residency in OB-GYN because you knew it wouldn't be good for your mental health, and you said it before. I was just wondering how important it sounds important to you, but how mental health plays a role in your everyday life and how you like make like what do you do to like calm yourself down on a stressful day, or like what are some techniques that you utilize to help with your mental health?
So during the first few months of COVID, being very isolated, I was on what's called like the dedicated block um, for medical school, where it's like a short time in between finishing your didactic stuff and before starting rotation. So it was like like a 2.5 month thing where you're supposed to be studying for your board exam. So that was all I'm not supposed to be going to class. I'm not supposed to be going to rotation. So I'm supposed to be here alone. But COVID makes it even more isolating because I can't even have people over if I wanted to. And so that became a very challenging thing for me, more than I ever thought it could be. So around actually in August of that, I made it a few months in and realized I'm not doing too good. I ended up adopting a cat. His name is Salem. He is the best boy, and because I wanted to pursue like animal therapy before I pursued anything else, to help, and he really saved my life. He is a great boy. His fifth birthday is coming up in August, so I've had him for almost 3 years now, and so he saved my life. He changed my life. I love him so much. And then since then, I've adopted two more cats, so I've kind of become the crazy cat lady. But I think cats help my mental health incredibly. I come home and these cats are right there like dogs would be, saying hi, screaming, all this stuff, and they want to cuddle with you at night, and they want to just be next to you. I think that is so comforting for me, and that just I look forward to getting home to seeing them and that helps so much. And then also in a recent few weeks, I've also started therapy, which I think has been excellent. I kind of regret not doing it beforehand, just because residency is hard, and there are a lot of challenges with making that transition from being a medical student to being a resident. Just the mental mindset of like I need to be an attending one day, I need to be like independent one day, and if I don't learn, you make yourself feel bad. Like if I don't learn this the right way, then I'm gonna be a terrible physician in the future. So a lot of like imposter syndrome, a lot of dealing with like the feelings of like letting yourself down. So just like working through all of that, and then also like with my fiance, just making sure that we're always talking about like what we want to do and in the future if we're going to move and all this stuff, and just like having that open line of communication. That's another way to like ease my mind and help me get through the next 2 years of residency.
I got a dog during COVID too, so I know it was like he was like our little COVID puppy, and he's gonna be 3 in about a month, which is so crazy to think about because it feels like yesterday really that it happened. And yeah, his name is Blaze. He's the sweetest boy, but he's really funny, and he was so great for our family too. So I know what you mean, having therapy animals, and well, they're not even really therapy animals, but they feel like therapy to me. He's so
Yeah.
sweet. And I'm going to go a little bit off topic, but we know that you have a TED Talk. How did that opportunity come up for you? Because obviously that is a very big and exciting opportunity to be able to have.
Yeah, so I applied to do a TED Talk in 2020. So I had an abstract. I think I was talking about one of my study abroad programs, and I submitted it, and I was rejected, unfortunately. And doing a TED Talk has been one of the things on my bucket list for a long time, like my professional to-do list. And so I didn't get it. I was like angry for a second. I'm like, well, I can come back next year. There's no stopping me. So came back the next year with a way better abstract, and I was very thankful that I got accepted. And I did not know going into a TED Talk how work intensive that would be. Um, it Looking back at it, it's just like funny like how much work goes into it. So about 6 weeks leading up to the event, you're doing 5-hour rehearsals on Sunday every single Sunday. And so it's very work intensive. So but of course in the meantime you're rehearsing your script. And so and you also have a personal mentor, someone within the TED organization who meets with you during the week to see what your progress is, to read your script to see if they have any recommendations on changes. So it's very work intensive. It's like 6 hours of meetings throughout the week, and then you're practicing on your own throughout the rest of the week. So my fiance would sit on the couch, and I would just go over it, over it, over it, over and over and over again. And it's 15 minutes, so it's timed. It cannot be more than 15 minutes. And they want to be as close to 15 minutes as possible. So you're trying to like get the nail right on the head. And so it's extremely work intensive. During that time period, I also like, I was like, oh my gosh, my stomach keeps hurting. My stomach keeps hurting. And it didn't go away for like a week. And then it was like almost 2 weeks. And I'm like, oh my gosh, my stomach is not, I'm just like not an ill person. Like I don't have any illnesses. And I'm like, I think I might need to go to urgent care. And I was like, I don't know what they're going to do for me because a stomach ache is a stomach ache. And they did a bunch of things there, and they're like, you need to go to the emergency department. And I was like, okay, fine, let's do this. And so I ended up having to have my gallbladder taken out that weekend. And so my fiance and I had like just met at this point. We were only together for like a month. So like I'm in the hospital with my dad having surgery, preparing for my TED Talk at the same time. It was a very interesting time period. And I look back at it because I was actually talking with my aunt about this yesterday. I'm like, I look back at the time period. I'm like, how in the world did he even want to stay with me? Because this is just not normal. Like, what girlfriend goes out and has to do this extremely difficult thing, having a TED Talk, 6 hours of rehearsal throughout the week, and then he's sitting on the couch listening to more rehearsal time, while in the meantime I'm like getting sick, having surgery. He's like meeting my dad for like the second time ever in the hospital. And it's just like it was a very interesting time in my life, and I'm stunned that I was able to perform my TED Talk with minimal difficulty, to be honest. it went very smooth. It was super cool. The cohort of the other like 5 or 6 people that did the TED Talks at the same time, we're still friends to this day. Whenever there's cool things that relate to their TED Talks, we always like send it to each other and like, hey, like miss you. And it was just like a super cool thing. And maybe in the future I'll do another one, but I'm not sure that I can beat the first one.
No, I listened to it and watched it. It was amazing. One of our things on the pre-med pod is we want to bring attention to women in the medical field, women in STEM. And I heard the story you told about when you first went to the hospital to get your badge and they were asking you about like being a nurse. And I actually had a very similar experience a few days ago when I was shadowing um, the the trauma surgeon. She let me. Well, she's friends with the head of neurosurgery at the hospital, so he let me go in and watch his surgery. It was super cool, and towards the end of the surgery, a doctor that was in the room. I think he was a doctor. I'm not 100% sure what his role was, but he was in there helping with like the background stuff. He was like, "Oh, do you want to be a nurse?" And I was like, "No." And he's like, "Do you want to be a scrub nurse? Like, that's why you're here." And I'm like, "No, like, I want to be a neurosurgeon." And he's like, "Oh, I didn't expect that." And I was like, "What?" I never realized how, like, it didn't like sink in. I never realized how, like, not like I just never realized it was so like bad like that. And after that I was like, Sienna, we need to like make this podcast like women in STEM, because there's no way that that just happened to me. Like, I'm not even in medical I'm not even in college and I experienced it. So how was that like really the first time that like had an experience like that, or were there other times that you experienced some like down talk and stuff like that? And is that why you got into feminism, STEMinism?
Yeah, absolutely. So, like you said, during my TED Talk, I discussed a few things that have happened to me. And the first real time that I had experienced something like that was when I was getting my badge, which is, not a great introduction to medicine, especially as a medical student. I was so excited to start rotation just to get out the house. Like during COVID, I was just like, finally, I get to go do something throughout the day. And so that was just very disheartening. And then also in my TED Talk, I discussed that following month during my surgery rotation, which is, not my thing. I'm not a surgery person. I don't enjoy the surgery rotation, just because like it's early mornings, long days, standing up, throughout surgery all the time. So it's a very intensive rotation. And so one of the residents who I was running with was like, hey, this guy needs his packing taken out and new gauze placed. So I was like, I would love to do that. And so I was getting ready to do the procedure, and I wasn't going to anesthetize the patient. I was just going to do it. And I imagine that not being as pleasant as, just changing a band-aid. So I was like, oh, I'm going to distract him a little bit just by chatting with him so he can tolerate this well. And it's early in the morning. Like, this is probably not what either of us want to be doing in the morning at, 5 in the morning. And so I get my gloves, my sterile gloves on to start the procedure. And he's like, oh, I don't see a wedding ring on your finger. I don't know why you'd be like getting up this early in the morning wanting to do this if you're just going to be a stay at home wife or mom one day. And it's just very disheartening to hear patients say that about like the care that you're giving them. Like, I could really make this hurt right now. And you think that you just want to be nice. And if you don't have anything nice to say, then you think that you just not want to talk at all. So it's very interesting to see that patients see that. And like I think the most classic thing you'll hear, besides like a situation like us with the badges, is when you walk into the patient's room, especially in the emergency department, and the patient's on their phone, and they'll be like, "Oh, sorry, I gotta go now. The nurse is here to chat with me," and they hang up. And I'm like, "Nope, not your nurse. Sorry, I did introduce myself as your doctor earlier." And we have whiteboards in our ERs where you like write down like the resident's name, so like doctor whoever. So it's on the board. I have a badge that says physician in big black bold capitalized letters. You don't think it'd be any more clear, but it's still lost on people. And so it's very unfortunate. And I would say the one thing that even I've caught myself doing, which I have been working on, and I think a lot of people need to do the same, is when you're chatting about something. So if a patient sees an oncologist for some reason, so if I'm going to try to ask like what the oncologist is seeing them for, it's really important to not say like, oh, what is he seeing you for? To assume that your oncologist is a man is just not true. For instance, at my hospital, the oncology team is mostly female. And so it's really important to, and the same thing applies for when you're talking about the nursing team. Um, Men and women can be nurses. And I think we say, like, oh, the nurse, she has to go grab something. Well, not necessarily. It could be a he or a she. And so I make it a point to either just be like gender neutral, just say like they're doing this or they this. Um, but I've recently transitioned to saying more like if I truly don't know who they're talking about and I've never, met that person before, um, I say like, what is he or she treating you for? To make it even more clear that like I don't know who your oncologist is and I don't know if they're male or female. Just to say like Dr. Smith, well, to me, I guess like Smith sounds manly. But I have no idea if they're a man or a woman. I don't know what their first name is, and I'm not familiar with that person. So I just try to make it very clear that I am being conscientious of women in medicine and not perpetuating those issues. And even when someone says something really messed up, for me personally, I can kind of take that and just move on and it doesn't bother me all that much. However, if I see like a medical student being treated that way, being misrepresented, or a fellow resident, especially an intern who's a year below me, I do not tolerate that. I think that they're early enough in their training that they may not know like their defense mechanisms and how they're going to deal with a situation like that. And so if I can especially see them being anxious about that or being slightly upset about what was said to them, I'm going to step in, because if you see something, you have to say something. Me personally, I can take that and move on, but some people, you just don't know what they're going through. You don't know what their past experiences are. And so that's the time that we need to step in. As a fellow female in medicine, you have to step in.
I really like that. And I think it's really unfortunate that there's a lot of people out there who tolerate sexism in the workplace, and not just in medicine, but in STEM. I think as a whole, female representation is not spoken about enough and kind of praised in that way. So, of course, what you said about seeing and saying something, how are there other ways that you teach people about sexism in the workplace and how people can be more opening or have an open mind about women in the medical field or in STEM in general?
So yeah, I think a lot of the things I just kind of mentioned would definitely apply. Um, Making it having inclusive language in medicine, stepping up for fellow females in medicine who may be having issues, and then also connecting people to mentors or advisors that can help them with navigating female specific issues in medicine. So if you want to have a pregnancy and have a baby, those are things, especially in emergency medicine, that I think need to be thought out beforehand. For me personally, I'm considering possibly doing so. We'll see if I'll do it as a resident. I don't know. But just knowing the place that you can go to breastfeed or breast pump um, is something that we need to know about. Because if you can't uh, breast pump, then one, you're going to be super uncomfortable, but then two, how are you supposed to feed your baby? So you can't have a baby without feeding them. And also just like being a pregnant physician, being 8-9 months pregnant, being in the emergency department, that's a very work intensive environment. And I can't imagine adding on like 25 pounds of baby and uterus and amniotic fluid and having to carry it around all the time, and having no break. And so I think having those mentors, people that have done that before, are super important. So for me personally, I'm thinking about it. So I've already started to reach out to a couple doctors who have had babies during their residency programs, or there's one also that was currently breast pumping as I was an intern there. And so just forging those mentorships and then encouraging other females in medicine to do the same thing if they're interested in that pathway for themselves and their family, is super important. Knowing that you have that community that you can go to for questions and all of that, it helps bring women in medicine together, and it helps bring women in medicine up as a whole.
I think that it's super important to continue and to make sure that not just women in medicine, but even men in medicine, if they see something like that, they, like they should say something too. It's not like one or the other. And like we were kind of saying before with the nursing, men can be nurses too. Like it's not just a women, like obviously that is what we're talking about, but like I just think like the inclusive language, like you were saying, is super important. Everything that you guys are talking about, I mean, like I really admire that you're so open about it and willing to, like help people and like teach people about it, because honestly it's actually really sad. Like I never really, I obviously I knew about, like the lack of, I wouldn't even say disrespect, because I don't even know if the patients realize it, but I mean it is disrespectful. I never realized that it was so bad until, like I experienced that. Like mine wasn't even that bad, but I was just like, what? Like I never realized that this was super super like prominent issue. And even just being in the hospital, there was mostly male surgeon. I think there was one female surgeon, and she was the one I was shadowing. So I was like, this needs to change. And I loved that in your TED talk talked about, I think it was like 51% in 2019 of the medical students were female. I loved that. I think that is so, it's just very evident in everyone's work, not even work, but, efforts to, like get, like to make, to like talk about women in STEM, women in medicine. I feel like it's super, it made me really happy to see that.
But we're still looking for more improvement on the other front. So it's super great that we have now a majority of female medical students being accepted into medical schools, but we still need so much more work on other fronts. So women being accepted into surgical residency programs, women being directors of their departments, being program directors and assistant program directors for residency programs. There's so much more work that still needs to be done. But I will say, for instance, my residency program is great. Our program director and one of our assistant program directors is female, and that's one of the both of those women are the reasons that I wanted to go to that program, was to have that mentorship, and I didn't know if I was going to get it somewhere else. And my assistant program director, she has life experiences that I really want to soak up all of her wisdom and knowledge from, and so I can be like the best version of myself, the best mom, the best resident, the best provider, best everything that I can be in the future. And I felt like I could get that at that program, but not all programs have that, and that's why we need to do more work in this area.
What are your goals after your residency? Of course, advocating for women in the medical field in general is a very big part of your life, as well as emergency medicine and osteopathic medicine. What do you see yourself doing after this in order to fulfill those goals?
I am possibly thinking about doing a master's of health administration. We'll see, it's kind of plus minus right now, but some type of education in that field to be able to take my education to the next level, to be more of the administration for an emergency department would be my ultimate goal. So we'll see when and if that happens. And then I'm also just interested in doing more travel, learning more about people in different areas, and of course, just advocating in every way that I can, being a mentor to others, and maybe in the future being like an assistant program director or something where I can show my formal mentorship towards residents and medical students.
Going off of it a little bit, how did you grow your social media to, you had your TED Talk and talking about, your journey in the medical field in general. How did you grow such a platform?
So I originally started my social media page, which is My Miles to Medicine. It's on Facebook and Instagram. I originally started the page to just share my writing. I used to hate writing in high school. I hated it so much. And I think it was just because I was given assignments that I just didn't really want to write about. But as an undergrad medical student, so and forward, being able to write about things that I wanted to write about and publish them in a variety of different areas was super exciting to me. And so I just want like a platform to share that stuff, whether it be like a formal, like an oral presentation, like a TED Talk, or my written works, or the things I've been published in magazines for. So that's where it started. And then I think just a lot of the different, I've been a part of several different programs, study abroad programs. Also last year, I actually went to a rehab center, the Hazelwood and Betty Ford Rehab Center in California, to learn more about addiction medicine. So I just participated in a bunch of um, different things, and I think just like that reaches certain groups, and I meet different friends, and I think that just expands the network. And so from there forward, I've just tried to continue to do that, share my different um, things going on, like different conferences that I've attended, and all of that throughout my medical journey. And so because it has been successful, I hope that means that people will want to hear more. And so I've just been continuing to put some stuff out and see if it grows.
I was scrolling through your page and I love it. I honestly, it's super, like I said before, I it's so eye-opening because you never really you hear about it, but if you don't have a direct like experience or like something like that, like you don't really like comprehend it. And I feel like your page is really really good. I love it a lot.
Thank you.
So we'll definitely tag it in our post and stuff. But what do you what is the most exciting thing that has come from your page? Like any opportunities? I mean, I know the TED Talk was great, but any other kinds of opportunities that you've had, or things that are going to be happening that has really like solidified your like presence in the STEMinism community?
So actually, this weekend, 2 days ago, I was able to present a STEMinist science experiment on stage. I was competing in a pageant. I didn't win, and that's my own fault. But I really enjoyed getting up on stage. I had pink scrubs on, I had my white coat on, and just talking to the audience about the experiment and about like how medicine is relevant, fun, easy to understand. We can all be scientists. We can all be physicians, and it's all around us. Science and medicine are truly all around us. And so that was super exciting to do. That was my first time doing something like that, being able to talk, on stage live, about the actual science happening instead of, my TED Talk was different. It was talking about my experiences. This is actually doing live science, and that was just so cool. And so now that I've done that, and I've gotten over my nerves about that, I think I see myself doing some more like that. I love to participate in podcasts and things like this, but I think I want to maybe do some more like on stage things. And I think that's probably what the next step in my journey will be.
I think that's really really cool. Like that opportunity, like what was it like what like give me some more information on that little pageant.
Yeah, so I was doing what's more colloquially known as like dinosaur toothpaste or elephant toothpaste. It
Mm-hmm.
is when you have a beaker of food coloring, dish soap, and concentrated hydrogen peroxide, and you add in a catalyst, which is potassium iodide, to make it explode and make a funny color, and it's really cool. And so again, kind of like my TED Talk, I had to make a script. I had my fiance sit on the couch and listen to me present it over and over and over again, until it was seamless and flawless. And so I was able to go on stage and present that. And I think one of the coolest things was, in the audience there, there's parents, there's family members of the other contestants, there's the judges, of course, but I saw a lot of young ladies who were there to represent their like other pageant winners were in the audience. So the junior miss and the little miss, this and that. And seeing them engaged, watching what was happening, I can only hope that one day in the future that they um, will pursue things like that in the future, whether it be a career in medicine or STEM. And it was just super cool. And so among just the talent, that was my talent portion of the event. There's also we do athletic wear, we do We do gown, we do an onstage question, which is super anxiety provoking, and then a behind closed door interview. And so I love talking. I talk all the time. I talk in a variety of settings, and I love to write. But yes, on Friday, it just didn't seem to be my day. I just could not get my words out correctly. And but nonetheless, I had such a fun time presenting that experiment, and I hope to do similar things in the future, doing different experiments, doing maybe some like heart models or something like human medicine focused stuff, and we'll see where that takes me. Now that I've know that I can do it, I feel like I need to do it more.
I really like that, especially because I think I was in like third grade and I was in a science fair. We did like a very small scaled elephant toothpaste kind of thing. We came in third place, but it was really fun. So every time I see those it or hear about those like kinds of experiments and those videos, you see them all the time. It's super cool and it just like brings me back to like the science fair. I remember me in like my little soccer uniform because I just came from soccer
Mhm.
and yeah, I don't know. That's that but that is a really cool experience. I definitely, like when I'm like a resident or something would like to look into that. That's super cool.
Yeah.
I heard a lot about your fiance being really supportive, listening to you. How do you think your relationship has helped you kind of grow in the medical field and, of course, with the pageants and presentations? Because I feel like relationships are really important in personal growth as well. How do you think that's benefited your life so far?
Yeah. So my fiance and I have been together for like 2.5 ish years. And we met right in the height of the pandemic in January of 2021. And so that first few months was a kind of a whirlwind. My TED Talk was in the beginning of March. And so uh, between like all the stuff that happened there, I knew that he was definitely a keeper just because of how supportive he was in those circumstances. Because I think if the tables were turned, I'd just be like, whoa, like what am I getting myself into? Um, but he's literally always been there. He One of the more challenging things that we've been through together was I went to Africa for 6 weeks, and that was very emotional. Just having to say, of course, bye to my cats, and then to say bye to him at the same time. It was just overwhelming. But always making sure that even though we are 7 hours difference time zone wise, we always made sure that we had that time to talk, to reflect on the day, update me on things that were happening at home. And then also during my trip to Africa was match day. So I was there when we found out where we matched for residency. And so obviously that's going to, impact where we have to move. And we did move. And it was just the cutest thing. He had made a party at his family's restaurant, and obviously I wasn't there, but they had cake, they had balloons, they had all these things to celebrate match day, even though I wasn't even going to be there. And they had FaceTime going with the whole table, and it was just like it really showed how supportive he is. And he comes from a background where he's not in the medical field. None of his family is also in the medical field, and so learning about like what match day is and like what board exams are, like step one, step two, like all these things. He's really uh, made it a point to learn about all these things and support me along every step of the way. I just finished step three and passed that. So we went out to dinner to celebrate that. He's always being very celebratory of the things that happen because it's not easy and it's not fun. And he's just really been there for me throughout all the ups and downs. And our next big challenge that we'll have to take on is where we want to move for being an attending physician, just because in Michigan there's not too many jobs available for an EM physician. There's just so much supply and there's just not enough demand to equal that out. So we'll probably have to move, and figuring that out and navigating that together will be um, the next thing that we need to do. But he's just always been there for me, very supportive. And if you don't have a person in your life that's supportive like that, get rid of them.
Now, that sounds super sweet. We love people like that. We love him.
Mhm.
That's great. I'm so glad that you have that because speaking to other, like students, medical professionals, residents, a lot of people talk about how supportive their, like partners have been. So it's great to always hear that. It's very obviously your face lights up when you talk about it, so that's great. So yeah, I mean, he sounds really, really, really supportive.
Mm-hmm.
Do you have any ideas of where you might possibly want to move together after residency?
That's a very contentious question. At this, I'm thinking possibly. I'm very open. I really don't have any objection to anywhere besides like Tornado Valley or hurricane areas. I just don't want to have to deal with those things. That would terrify me. And I prefer somewhere that's not like super hot where it gets like 120 degrees during the summer. So that leaves a lot of the country left.
Me and
So
Sienna
I
are out.
will.
Florida and
So
Arizona.
yeah, so it's like that is overwhelming to me, and I think that I would truly like be fainting too much. Like I'm a fainter in general. That would be one of my triggers, and I don't want to do that. So I'm thinking like maybe Gulf Coast of Florida, maybe the like somewhere in the Midwest. I'm very open at this time, and I'm just now starting like the career journey, like talking to recruiters and stuff like that. So I still have about a year to like really think about things, and then about this time next year is when I'll be like really getting into it, like looking at potential contracts and looking at um, like housing and things that are about living there. So at this point, I really don't know, but yeah, East Coast, Midwest, somewhere in there.
I think it's great that you have like like small idea and like a gist, and you have plenty of time. And that I keep telling myself, oh, I'm freaking out about graduation and everything, but that's in about a year too. So there's still plenty of time. And of course, yours is on a slightly bigger scale of moving, but yeah. I think that we're going to slowly start to wrap up our episode. But one thing we do at the end of our podcast is we have 3 rapid fire questions. You can answer them as long, as short as you like. And yeah, we'll just get started. Our first question is, what is one piece of advice you would give your high school self?
I would give the advice that everyone's journey is different than yours, and that does not make it better, worse, or different. Um, you can be a physician, um, even though that seems like it's so far away as a high school student. Keep with the faith, keep going, and you've got this.
I love that answer. I think, it all comes down to believing in yourself. Like, you got this, A lot of times I know that I freak myself out and I'm like, this is crazy, because I try to do as much as I can, like with all the hard classes and stuff, because genuinely that's what I like to do. But, it does get hard and challenging sometimes. So I feel like always going back to it sounds basic, but like, believe in yourself. You have this, you can do it, is the most important thing. Because if you don't believe in yourself, like, you what are you gonna do? So love that. And I know we talked about your relationship, your fiance, super supportive. Our second question is, how do your relationships play a role in your life? So how do your friends play a role in your life as well as your fiance?
Relationships are truly everything when it comes to navigating life as a resident. You have so much time that you're spending at work, so having the relationship with your co-residents is super important, making sure that you're making time for each other for in ways that are not medically focused. So having brunch or going out to movies or something like that is a great way to have that camaraderie and commisery with your residents. I also think that having good relationship with your family is very important. I think it's very important to be intentional about what you're doing and when. So, for instance, if I go home to my family, which is a couple hours away, I make it a deal where it's like I'm not going to do any studying or any work related stuff while I'm there. I'm there to see my family, and then when I arrive back, that's when I can continue doing my study stuff. And so I'm just making it very intentional that I want to be there, spend time, um, and I think that's super important. No matter who that person is, your family, your fiance, your cats, your anyone, um, important to have that intentional time with them.
I totally agree with you. Everything you're saying I agree with. But I know you talked about your cats. This is kind of off topic, but also on topic. How do you make time for, like being with your cats? Because I know it's far away, but I really want a dog in, like residency. But like, I love dogs. I have one. But I've been thinking about it. Like, how do you have time for that? But I don't know. How do you like balance the animals and the work?
I love how cats are so independent. You can like leave them alone all day and they'll well, my cats are still struggling with the whole like litter box, like poop in there and pee in there type of deal. But more or less they're good at it. And so I love how self-sufficient they are. I know that one of the people that I went to medical school with, she had a Chihuahua and she litter box trained her dog. And so she was able to stay out at the libraries for longer periods of time because the dog would poop in the litter box. So I think I'm very allergic to all animals, and so I have struggles with my three cats. There's a lot of fur in this place, but I think dogs are worse for me personally. But I would say that if I were to get a dog, I would try to get a small breed dog and have them be litter box trained. Um, and I think also like one of my cats, her name is Kitty. She just wants to be laying on you or touching you in some way while you're doing anything like computer, textbook, whatever. And so that's our cuddle time. And so we I can do my studying, she can do her like her very necessary cuddling. Um and then my other cat, she's relatively new. Her name is Pookie Wookie. And so she's a little bit scared still, so she's kind of minding her own business for now. We'll see in the future what her personality develops into. But um I think it's just so important. Like when you come home, you give them hugs and kisses, and you feed them and give them their love, and then do your own necessary things. But if you have cats that like to cuddle, like that's your time, and it's just the best thing ever. I love them all. Salem, Kitty, and Pookie Wookie.
Love those names.
Our final question that we have for you is, what is the biggest challenge you're facing right now, and how are you tackling it?
Right now, my biggest challenge is figuring out what I want to do and where I want to do it in the future. Um, for working on that, I have met with my residency advisor and chatted with her about um, like if I were to do this route, what should I do next? If I want to do this route, what should I do next? So just trying to put together that mental to-do list of like what I would need to do, but also having to like force myself to make a choice on like, do I want to go into a fellowship? Do I want to go in to do a master's program? Do I want to just work? Like, what do I want to do? But how do I make that happen? Um, so we're chatting about that right now, and my goal is within the next couple of months, middle of fall, to have a better idea of exactly what I want to do and where I want to do it.
I've actually, I don't know why I haven't heard of it, but I haven't really heard of mentors for that. Are they separate from, like med school in general? Do they help out anybody with careers past schooling, or how does that work?
So our advisors are faculty members of our residency program. So they are ER physicians at the program that we work at, and they also are, for instance, my advisor is the assistant program director for the residency. Um, so she helps me with that. But then also there's recruiters that that we can talk to that can help us figure out what would work best for us for a job in the future. That's pretty much the only thing they can help with is specifically the job. But if you're someone who doesn't want to do fellowship or anything additional for their education after residency, that's the person that you'd want to go to talk about that. And there's recruiters from all different areas, and they can kind of find any level, they can take your interest in things and find you a good fit.
Honestly, I think having a mentor is something super, super important. I did some research this year and I had a great mentor. And I think, I don't know how I would have gotten through it without her because she really was there for me. Even if I, like was stressed out about it, she helped me with my like own self. Like it wasn't just about like the research. I think whatever I do, I'm definitely going to like wherever my path takes me, like that's what I need. I love talking to people that have like, gone through similar things which is another reason we love doing this podcast. I think it's super beneficial. So I love to hear, and I've heard from like so many people that we've already talked to, like, you know, like having a mentor is something super important and something really beneficial. So that's something really amazing.
Yeah, I think that it's great that there are people who are able to be independent in their journeys, but I also think it's not talked about enough, or it's less kind of noticed that it is so important for people to have advice and other support around them. And I think there is a line of where people maybe feel like they want to be self sufficient, but I think for me, even as simple as having my counselor at school and having her help me with possibly places I want to go to college and how I get through all of my credits before high school, how I can be more involved. I think even those little things are so beneficial for me, and they are so important to have other people there to give you advice or give you the extra support that you may not even know you need in the moment.
Absolutely.
Thank you so much for coming on and sharing your wisdom in the medical field, but also as a woman in the medical field. We learned so much, and I'm super grateful that you came on. We had this opportunity to speak to you. Thank you so much.
Yeah, thank you for having me.
Have a great rest of your day, and we'll definitely keep in contact with you. And we're really looking forward to seeing your journey online and